Okay, we can go. So welcome to Dr. Prisco Piscitelli. Dr. Prisco Piscitelli is a member and vice president of Società Italiana Medicina Ambientale, that is an Italian society for clinicians and doctors for environment. And so I will give the floor to him to present himself. And today, the topic of the talk will be the relationship between COVID-19 and air quality. This is very, very hot topic, we can say. So let's stand on the speech of Professor Piscitelli. So the floor is yours.
So, hello, my name is Prisco. It's an ancient Latin Roman name. My surname is Piscitelli. I'm a medical doctor. I am an environmental epidemiologist with specialization in public health and a PhD in biology and biotechnology. And currently I am the vice president of the Italian Society of Environmental Medicine. So I hope you can hear me. If there are problems, just please tell me. Our scientific society, SIMA, the Italian Society of Environmental Medicine, has committed since the early month of March, the end of February, so since the beginning of the COVID-19 epidemic, on the topic of air quality and possible relationship with the transmission of COVID-19. Today is a good day because actually an official study of the Italian Institute of Public Health, so namely the Istituto Superiore di Sanità, has just published a paper which is currently confirming this observation that the SIMA researchers made at the beginning of the epidemic, and it has been just published on a prestigious journal called Environmental Pollution. However, since the month of April, we have published two papers on the International Journal of Environmental Research and Public Health, claiming for a possible role of air pollution, so air quality, and the transmission of COVID-19. Okay, so it is a problem that is concerning both indoor environment and outdoor environment. But however, for indoor environment, it is simple to understand that people that are sitting in an indoor environment, and especially if it is crowded, they have a risk to get infected in presence of an infected person. For outdoor environment, things are not so clear. However, what we can say is that COVID-19, which is due to SARS-CoV-2 virus, is known to spread via respiratory droplets and close contact. So, but this transmission model does not seem to explain properly the different initial spreading of the virus observed in our country, in Italy, from the month of February, let's say from the end of month of February, to the middle of March, which corresponds to the period just before the first Italian lockdown. Actually, what happens? It has happened that the huge virulence of COVID-19 in the Po Valley, we call La Pianura Padana, so Lombardy, the region of Venice, and the region of Bologna and the Turin, so Piedmont, Emilia-Romagna. The spreading in those areas was not comparable to the milder contagiousness observed in other regions, and demographic factors related to the aging of the population and the possibility of infection without clinical symptoms for a quite long time. So may only partially explain the fast spreading of this virus in Lombardy and northern Italy. There were some authors, Kai et al., that reported the different incubation periods in patients infected in Wuhan, but epidemic model based only on respiratory droplets and close contacts could not fully explain the difference observed in the regional spreading of COVID-19 in Italy. We have to almost remember that we have a very unique lethality rate for this region due to COVID-19, which was fast and dramatic only in Lombardy and Po Valley. At the same time, a number of studies have shown that the airborne transmission route could spread viruses over a distance of 2 meters from an infected person. Everybody knows that the distance of 1 meter was proposed as a safe distance, but we know that this distance should be better explained in 2 meters, as recently also confirmed at the end of September by the last position of the Center for Disease Control from Atlanta, so in the United States, that have also included the possibility of airborne transmission route through the adhesion of the virus to particulate matter in very particular cases. What are these cases? The ones that were happening in Italy, in the Po Valley, at the beginning of the epidemic. So high circulation of the virus among people. A lot of people spreading the virus in the streets because they were not wearing the masks at the beginning of the epidemic. It was the end of February, the beginning of March. So a lot of virus emitted by people, a lot of droplets, high concentration of particulate matter. We've been the first to demonstrate the presence of SARS-CoV-2 RNA on PM10 in Bergamo, but we had average values of 50 micrograms per meter cube of PM10. And then the atmospheric condition and humidity that were ideal in that period. So we know that Paulus et al. Have already in the literature observed that besides close contact, airborne transmission of SARS-CoV can also occur because it has been reported for other pathogens, the airborne transmission that allows virus to reach long distances. Other authors, such as Rech et al., described the aerosolization of soil dust and organic aggregates in sea spray that facilitates the long-range transport of bacteria and likely of viruses free in the atmosphere. In particular, we can say that virus deposition rates were positively correlated with organic aerosol, implying that viruses could have a longer persistence time in the atmosphere and consequently can be dispersed further. Other authors, such as Quinn et al., analyzed the microbiome of the airborne particulate matter in Beijing, in China, over a period of 6 months in years 2012 and 2013, putting in evidence variability of the composition that depended on the months analyzed. Temporal distribution of the relative abundance of the microbiome on particulate matter showed the highest presence of virus in January and February in China in 2012 and 2013 in Beijing, just in coincidence with the most severe pollution due to particulate matter. So Chen et al. Demonstrated the relationship between short-term exposure to PM concentration and incidence of measles, so other infectious disease, in 20 cities of China. And their meta-analysis showed that in China, measles incidence was significantly associated with an increase of 10 micrograms per meter cube in PM2.5 levels. So we already knew that for other viruses, there was the possibility of airborne transmission route, so that the viruses can travel through the particulate matter in certain conditions of diffusion of the virus, of temperature, of atmospheric stability, all conditions that are needed to let this happen. So this was our starting point. But other recent studies have also reported association between particulate matter and infectious diseases, also for influenza, for hemorrhagic fever, with inhalation being able to bring particulate matter into the lungs, and so also the viruses attached to the particles that may directly invade the lower part of the respiratory tract, enhancing the induction of infections, as demonstrated also by other authors, such as Sedlmeier et al. Other papers carried out by Zhao and colleagues has showed that the majority of the patients positive for the highly pathogenic avian influenza H5N2 in Iowa in the US in 2015 may have been infected by kind of airborne viruses carried by fine particulate from infected farms. Also for other virus other than measles, there were some evidence suggesting that viruses could be brought and transported through fine dust. Ferrari, but also Ma and colleague studied the diffusion of measles occurred in China and US respectively. On-field measurements recently carried out by Liu et al. Showed evidence of the SARS-CoV-2 RNA in indoor air, sampled in Wuhan hospitals, and even in the outdoor ambient air in close proximity to the hospitals of Wuhan during the beginning of the COVID-19 outbreak. Highlighting therefore that the possibility that airborne route is important pathway for contamination also for SARS-CoV-2. Recently, as I said, as a SIMA, we have published the first evidence in the world of the presence of COVID-19 on SARS-CoV-2 on outdoor PM in samples collected between 23 of February and 9 of March in the province of Bergamo in Lombardy, which experienced the highest diffusion and mortality rates in Italy. And everybody knows that after that, a research carried out by the Harvard School of Public Health that, although it is not already published, at least it was not until last week, this research carried out by Francesca Dominici and colleagues seems to confirm an association in the US between increases in PM concentration and mortality rates due to COVID-19. These are the evidence, the scientific evidence that were questioned at the beginning of the pandemic, because of course there were some publishing processes still ongoing, and we know that some papers are still not published. Other, such as the one I was mentioning at the beginning from the Istituto Superiore di Sanità, the Italian National Health Institute for Health of Public Health, have just been published. However, I think that it was important to make the scientific community and the decision makers aware of this possibility, because of ethical duty of researchers to make available all the possible evidence to decision makers for public health reasons. At the moment, you have the evidence, although the evidence is not already published. And this was the choice that Harvard and SIMA has made in April, while starting the publication processes. We made, however, 2 publications at the end of April, one at the end of May, and then the last one at the end of September on British Medical Journal Open, BMJ Open. What we can say is also that our scientific society, SIMA, has started as an international scientific debate on this topic. We have promoted an international commission of experts named RESCOP, Research Group on Air Pollution Particulate Matter, which is now a thematic commission of a prestigious journal such as Environmental Research, which is published by the Elsevier editor. And we have also we have promoted a special issue on environmental research entirely dedicated to the outdoor and indoor air quality and COVID-19, which is generating a lot of evidence in about 3 months and a half. There are already almost 20 papers published on this topic, just on this special issue. So we believe that we are doing our job as scientific society in fostering evidence on this topic. So what we did specifically as a SIMA, that was in our position paper and then in our publication on BMJ Open at the end of September, was to search for a possible association between the initial spread of COVID-19 in Italy, registered from the end of February to the first weeks of March 2020, specifically from February 24th to March 13th, and the frequency of daily average concentration of particulate matter. So that was the topic of our research. The research hypothesis that we addressed was the possibility that air pollution could produce a boost effect of the COVID-19 epidemic, thus representing a kind of exceptional super spread event. In the frame of an observational design of the study, we have analyzed, I can show you some pictures. So these are the papers published at the end of April. Here it is. We have analyzed the situation of daily PM exceedances. So it is the frequency of exceedances. How many days of PM10 exceedances, but PM 2.5 was almost following the same pattern of PM10. The only difference is that for PM10 we have samples collected all over Italy by the regional environmental agencies, while for PM 2.5 there are a few samples machine collecting this kind of pollutant. However, as you can see from the figure, the provinces, the cities and the provinces of the Po Valley of northern Italy and a little bit of Marche region were experiencing a lot of days with PM10 exceedances. So the frequency of the exceedances was really high. And if you see in the other picture the gradual diffusion during the first weeks of the epidemic of COVID-19, you can see that what is our starting point. So we have analyzed the daily data of PM10, also the urban conditions and the COVID-19 incidents from all the Italian provinces to assess if there was a possible association between PM10 and the initial spread of COVID-19 in Italy. So daily concentration of PM were collected by the official air quality monitoring stations of the regional environmental protection agencies, which are publicly available on their websites. And the number of daily PM10 limit value exceedances, which is 50 micrograms per meter cube, you know, it is a very high level, detected in the different provinces, was computed, but we have also computed for all the 110 Italian provinces also attention to we have also taken into account the number of inhabitants, so the density, so the number of inhabitants per square kilometer, and the number of commuters, so the people traveling from a province to another for job reasons, but also the tourists. So we have divided these provinces in two blocks, and we assessed that actually what happened was that less polluted provinces had a median of 0.03 infections over 1,000 residents, while the most polluted provinces showing a median of 0.26 cases over 1,000 residents. And that 39 out of 41, so almost all the northern Italian provinces resulted in the category with the highest PM10 levels, while 62 out of 66, so almost all southern provinces presented low PM10 concentration with a significant statistical difference. So we concluded that a significant association was found between the geographical distribution of the frequency of daily PM10 exceedances and the initial spreading of COVID-19 in the 110 Italian provinces. There were also some comparison made between some cities, for example, Milan and Rome, before the lockdown. No? You can see the boost effect, which is possibly due, according to our results, to the effect of environmental pollution. And this is the gap between Rome and Milan, which have almost similar conditions, starting conditions, because they had at the beginning the first cases almost in the same days as they were very few cases registered. And you know, this is the graph of the graphical representation of our sampling in Bergamo, where we found the viral RNA of SARS-CoV-2 in the last week of February, when we were sampling outdoor air in ideal conditions to do that. And this is the model that we have proposed for the super spreading event that give reasons for wearing masks in our cities. And of course, I can show you also the results coming from the studies from the other from the other countries. This is a study of Francesca Dominici in the United States, the study of Professor Kell in the UK and in the Netherlands. And you can see how the concentration of particulate matter, for example, in the city of Milan, is exactly duplicated by the graphical representation of the cases of COVID-19 at the beginning of the epidemics. So at this point, I could have a lot of things to say about the possibility of looking at the Po Valley as a kind of very big indoor environment with the roof positioned at some 10 or 20 meters up the head of the people. We have during the winter incredible concentration of particulate matter only in Po Valley. This is a very unique European case, and the European Commission has recently committed Italy punished Italy opening an infraction procedure concerning the air pollution in the Po Valley. So this means that kind of exceptional super spread event on the viral infectivity of COVID-19 could correspond in our research question to peaks of PM, and these hypotheses seem to be confirmed by our study, but there are hundreds of studies that are coming that are going in this direction. Concerning the Italian data, in addition to that just published by the Istituto Superiore di Sanità, so the Italian Public Health Institute, there is a very huge study published by the group of economists and epidemiologists from Tor Vergata with Leonardo Becchetti as first author. The potential role of climatic variables are also clear because coalescence phenomena require optimal conditions of temperature and humidity to stabilize the aerosol in the air, which have been assessed at around 0 degrees centigrade to 5 degrees centigrade and 90 to 100% of relative humidity. And we know that there are studies that have almost assessed these variables, these climatic variables that could have played a role, along with the presence of high concentration of PM in the air, favoring the stabilization of aerosols in the air, in line with the model that we have proposed. What is also to be said is that our study was an observational study, so there is the need for other studies to confirm the possibility that PM may act as a carrier for the viral droplets nuclei, impressing a boost effect for the spreading of the viral infection, as it has already been shown and demonstrated for other viruses. So it was reasonable, but still needing studies. And also virological studies should be performed and could be performed if the condition, ideal condition can be replicated. We don't know, because now we are all wearing masks, for example, face masks. Virological studies should specifically be aimed at testing the vitality and infectious potential of SARS-CoV-2 contaminated particulate matter, if any. So we cannot say that the particulate matter, the RNA that we found of particulate matter in Bergamo was infective. We just can say that we have found it, and that can be used as a kind of early indicator of epidemic recurrence, but not that it is infective. We cannot say that it was infective. And then it must also be pointed out that the long-term exposure to high levels of PM, of particulate matter, chronically impair human health and possibly influence the clinical course of infections acquired by debilitated individuals, especially in the most vulnerable age groups. It means that air pollution is very bad for our health, we know, and we know that the European Environmental Agency, EEA, publishes every year air quality report, and in Italy there are about 80,000 people dying for air pollution, according to this European institution. So it is a very bad phenomenon, but it seems that nobody cares about that, unless COVID-19 comes and kills a lot of people that are already impaired by long-term exposure to air pollution. But there are about 80,000 people dying every year in Italy because of air pollution, but we have no molecular diagnostic test to certify day by day that they are dying because of air pollution. So nobody cares about that. According to WHO 2005 guidelines, the annual average concentration of PM10 should not exceed 20 microgram per meter cube, but we know that the current EU and Italian legal limit is 40, the double. The same for PM2.5. According to WHO 2005 guidelines, the annual average concentration of PM2.5 should not exceed 10 microgram per meter cube. But the current legal limit is 25 in Europe and in Italy. In the United States, it is lower. But these levels are not protective for people, for the health of the people. So let's hope that this emergency due to COVID-19 has helped us to move toward a new sensitivity about the problem of air pollution, that is basically very bad for our health, independently from the presence of new pandemics. So thanks to everybody, and we can dedicate the last 20 minutes maybe to a kind of interaction if we have time. I don't want to bother you with other discussion.
Thank you very much, Professor Piscitelli, for your very insightful speech. And now, as Professor Piscitelli has mentioned, the floor is open for questions. And the floor is yours. You can use both the chat or eventually open the microphone and give your question. If nobody starts, I have a question. So first of all, thank you very much, because it's very insightful. Also, I can say on for my experience, because actually I'm working on air quality. Oh. And yeah, and something that I'm wondering till the beginning of the pandemic are these two things. One is you with SIMA have been one of the pioneers in trying to find the relationship between air quality and COVID, and the result of the RNA standing on what standing on my experience, is affecting at the short range. Correct me if I'm wrong. Maybe we can go a little bit deep on the possibility of the transportation mechanism. So it is not completely like true that the transportation is not something that we have to take care, because, for example, maybe, but correct me if I'm wrong, and maybe we can start on discussion on that. At the short term, it's valuable. So it's the short term, it has some impact. Maybe at the long distances and so on, there are no models still, or there are still studies going on. The other point, as you mentioned also in your presentation, is the exposition to bad air quality that is affecting the chronicity of several respiratory disease, and also affects also the morbidity of the COVID-19, of course. So you are exposed more, and so you are more affected to severe risk of hard onset of COVID-19. And on that, I want to ask you, which is your opinion about this, and which is your vision also for also on the transport part. And the second thing is related properly on one of my experiences related to the transportation. I had the chance to participate to like a project that is studying how the transportation has like has been impacted by this pandemic, and how, in a way, the COVID lockdown has represented like a sort of retrofitting of the atmosphere. So it's true that COVID is affecting that the air quality is affecting COVID mortality, but it's even true that the lockdowns measure is affecting air quality. So it's a two-way relationship.
You know that during the lockdown, the levels of particulate matter in Lombardy, for example, were during the month of March were higher than the previous month, because during the lockdown, people were at their home, and the heating to make warm the houses were on almost constantly. So the lockdown was badly affecting the air quality of northern Italian cities in that period during the winter. Of course, this was not in April or in May. And we know that there are also beautiful images of the Earth with a lot of very incredible reductions of the level of pollutants in many areas of the Earth. So in that way, there was an improvement in air quality at the global level. The problem of transportation is a very good point, because I don't know if you can see my screen now, but if you can see my screen now, you can see that there is a problem of distancing.
You can share again your screen. We cannot see. You can share if you want.
I can share it again. Yes. Yes, if you can see my screen, it comes out that there are problems in indoor environments, transportations, but restaurants, whatever you want, because a lot of droplets can be emitted with cough, for example. by people who are infected. So it is important in indoor environment such as train, buses, cars, to wear the FFP2 face mask in order, maybe the surgical mask is not even enough, and to maintain at least 2 meters of distance in order to minimize the risk of contagion. Of course, we have just performed a study published during the month of September as SIMA with the Pediatric Hospital Bambin Gesù in Rome, and that was assessing the efficacy of mechanical ventilation in the dilution, so of these particles, these infected droplets, up to 99% in indoor environment. So in presence of a person who is infected. So this kind of technologies that we have must be used in all indoor environments, in transportation, but also in schools now, where we cannot imagine during the winter after January the 7th to open the window for 1 hour while our children are wearing the face masks, because we have not been able to adopt any other security measure for them to make their classroom a safe environment, unless to oblige them to wear face masks for 6 hours. That is maybe something that nobody in our offices would do in a continuous way.
Thank you very much. Thank you also for sharing the material, and also Professor Betro, thank you for joining and for sharing. Do you want to also add something also, maybe on the point of view or of the perception of COVID-19? So I just introduced Professor Betro, that was in the previous session and joined it. So if you want to have the opportunity to speak, go ahead, Professor Betro.
Thank you, but unfortunately I have joined this session too later, but I hear only the few minutes, the final minutes, and I would like to share this article that relates death in younger to pollution, and I think it's very interesting, and I put in the chat group.
Thank you very much. And yes, I also invite you to, if you have the pleasure and time, to remain for the following roundtable, in which we are discussing with the other colleagues about properly COVID and the relationship between COVID and climate crisis and human health. So you're kindly invited to stay if you want.
Sophia, this link, Sophia, is related to the Justice Court of London of yesterday, that has recognized air pollution as a cause of death of the girl of 9 years old.
Yes.
So it is very important. We were discussing today in our scientific society this topic, and also at the European level, because it is the first time that it happens, and maybe this opens the way to a lot of legal prosecutions also in other countries. It is a kind of first step.
Exactly.
Because she was suffering from a very bad form of asthma. And this girl was living in a very heavily traffic road of London, and at the end she died for the asthma, and her mother did not accept the diagnosis of natural causes, that was put on her medical record, and so he rejected also the first sentence of British courts, and the second round of the process has recognized air pollution as the fatal factor or cofactor that has determined and led to the death of this very young girl. So it is today is a very important day.
I agree. It's an important and big step forward with this conclusion, the correlation of pollution and death. It's very important.
Maybe I can inform you that also today it has been published the Inception Impact Assessment for the revision of the European Union Ambient Air Quality Directives, and it could be important to contribute to that.
Thank you very much to both Professor Piscitelli and Professor Betrot, and I kindly invite also the participant to join the discussion. We are here from different countries also, and I was also asking to the participant if they want to share their experience also in their countries about the relationship between air quality and COVID and so on. So don't be shy, let's take the chance of this important session today that connect properly human health and environmental health.
Environmental health.
Yeah.
We have also other words now that have been released by and produced by the Lancet Commission, no? Planetary health.
Exactly. We had the introductory speech of Professor Flavia Bustreo that pointed out the concept of One Health. That is, of course, one is currently very, very on the topic, we can say, because now we properly understand which is the correlation. We had also a session, just to inform you, on loss of biodiversity from Marco Bertaglia on the session of Tuesday, and also there we encountered these interlinkages.
Okay.
As I said before, anche in italiano se volete, possiamo fare eventualmente la traduzione. Vedo che ci sono anche degli ospiti italiani, quindi non abbiate paura di fare domande, faremo poi una traduzione.
May I ask a question that may seem ridiculous? The question is, it would be possible to use special protective helmets on public transport in order to avoid contacts with COVID?
Giancarlo, I was not able to understand.
I mean, is it possible to use special protective helmets on public transport in order to avoid the risks of contamination? I imagine no one till now had planned such a thing, but technically, from your point of view,
and they should be monouso, one shot, or everybody should have the personal one.
Yes, everybody should have a personal one.
So instead of going around with the face masks, we should go around with the casco.
I mean, especially on transports, public transports.
Maybe people that go on motorbike, people who go on motorbike, no? as their helmet.
Anything like this is technically feasible.
I think, Giancarlo, that there is a problem, that it has passed the message that young people aged 20 years old, 18 years old, teenagers, they will never have problems if they get COVID, because they get the asymptomatic form. This is a problem because very young people tend to stay together and very close together, and so there is a spreading of the contagion among young people. They probably don't care about the risk of contagion of their parents or grandparents. This is a problem, in my point of view. The other point of view is that public transportation is totally inadequate. If you look at the Metropolitana underground of Rome during these last months in the second wave, they were plenty full of people. So it means that there is no attention for regulating the traffic of people entering the undergrounds, for example, as well as in the bus, in the public transportation, or yes, maybe in the train. Maybe in the train there is, because you have to buy the ticket, and so there is a kind of basic admission, no possibility of admitting or not admitting people. But in public transportation, where you simply enter a station of underground, or you enter a bus stop, there is no regulation, no people that is regulating this traffic of people, and we have a lot of people with reddito di cittadinanza at home that could be used to regulate this kind of aspects.
Okay, anyway, it would be possible. Technically, it would be possible to use helmets.
But I don't know. I would rather prefer to reduce the crowd of people in this bus or underground, and to have very effective and efficient systems of mechanical ventilation that are able to dilute the droplets.
Okay, thank you.
Oh,
Paolo, buon pomeriggio, Paolo.
Ciao Prisco, scusa, avevo lasciato il cavetto e non sentivo. Bene, tu?
Ben trovato.
Tu come stai?
Per quanto possibile, bene.
So welcome also to the speakers of the next session. So I just asked for last intervention if there are some other intervention from the floor, and even though we can close the session and pass on the next roundtable, this will be going a little bit in deep on the relationship between COVID crisis and health crisis and climate change crisis. So just asking if there are any other intervention. Someone want to add something or want to ask something to Professor Piscitelli? Even though, just a closing remark for this session, Professor Piscitelli, if you want to close with a final message or statement. Okay.
Let's move and let's try to do our best to reduce air pollution that is bad for our health.
Okay. Thank you very much to Professor Piscitelli for his presentation, and thank you the participant for the interaction. Now I will stop for 1 second the live session.